Welcome. I think we're going to get started. It's noon. My name is Bunny Ellerin. I am the CEO of DHNY, Digital Health New York. And it is wonderful to welcome folks to our first coffee chat. It's a new virtual series that's going to provide insights and perspectives on obesity. And so today we're going to be talking about the human impact of obesity. I just wanted to give you a little bit of background. We are part of the New York City Obesity Working Group, which we lead. It's comprised of stakeholders from employers, providers, health plans, systems, and government organizations. Why did we start this? Obesity has been in the news quite a bit over the past few years, particularly in the last year, and we felt like it just wasn't getting the attention as a chronic disease that it really deserved. So our group got together really to do two big things. One is raise awareness around the physical, emotional, and financial costs, but two, to take action, to do something, right? Not just talk about it. And that's really how today came about. We're starting this series to really address some of the gaps in knowledge, to educate folks who are in a position to make decisions, to help them with validated information. So today we are so excited to have two phenomenal speakers to kick this series off. First, we've got Dr. Holly Lofton, who's a clinical associate professor of surgery and medicine and the director of the medical weight management program at the renowned NYU Langone in New York. Dr. Lofton is an expert in the field of obesity medicine, involved in a lot of clinical research and lectures frequently, like she's talking today, but she lectures all over the world. And she is joined by Glenn Catania, who is a professional by day, but Glenn really is here to talk about what it's like to live day to day with obesity, to help those on the call understand. So I am going to turn it over to our speakers, and I'm excited to hear what they have to say.
Hi, everyone. Can you hear me?
Absolutely, Dr. Walker.
All right, great. And hello, Glenn. Glenn and I know each other well, even before doing this. I just want to let you know. So we'll talk like old friends. Again, thank you for your time. Please feel free to put any questions in the chat box, and we'll acknowledge them as the conversation allows, and we'll leave some for the end as well. Thank you, Bunny, for introduction. And I just want to explain my role. I think now, as Bunny mentioned, in the past year, there's more awareness of obesity medicine as a field of medicine, which I think is wonderful. I've been in this field since my training as a physician for 15 years, and I see patients every day for weight management. And I always tell you, the door says weight management. So I know why people are there, but I ask every patient, what brings you here today? And in response, I get a plethora of answers varying from my health. I want to see my kids grow up. I want to be able to move better, exercise more. I want to get off some medications and just generally feel better. So as we talk, I want you to think about some of your employees and even yourselves about why health matters to you, because we're talking about obesity as a chronic disease, but there are other chronic diseases out there that people want to improve or eliminate. And we know that obesity is related to a lot of medical conditions, ranging from cardiac disease, type 2 diabetes, a plethora of cancers, and joint disease, which are really common. So as we move forward, just remember that as we treat obesity, we're treating a lot of other conditions. Right. And we have Glenn, who's been so brave as to discuss his lifestyle and share some information with us. So Glenn, I wanted to ask you, what was the first time like that you sought out treatment for weight management?
Dr. Lofton, that's kind of a loaded question. I've been living with obesity since I'm 3 years old. My parents got divorced and I got a little crazy and I've been living with obesity. So as far as me personally seeking out, probably was until I was 21, but doctors were always telling me along the ways, Glenn, you need to cut back, you need to lose weight. This isn't healthy for you. Later on in life, I made my own decision that it was time to make some changes. And that's when I started. I was about 21 years old.
Yeah. I will also share, I know Glenn's a highlight here, that I had childhood obesity and my parents took me to the pediatrician. We got the same kind of message and we made some changes early on that really catapulted me into this field. So a lot of us are doing this because of personal experience, either themselves or someone they love, is living with this condition. And one thing about obesity, it can wax and wane. We consider it to be a chronic, meaning it exists over a person's lifetime, even when their weight is normal, because they're still using, even if they're using lifestyle or diet and exercise to treat it, they're still treating it in some way. So can you share with the audience, Glenn, some of the things that you've done in the past to treat weight?
Oh, I've been on every diet you can think of, intermittent fasting, vegetarian, gluten-free. I've worked with a bunch of commercial diet plans or diet centers that you would work with. So everything in my life, I've had some good success. I've had some not some great success. And what's interesting is it was much easier when I was younger, not so easy now. I think you have to find what works for you, but there's other things that are involved in that also.
That's a really good point. A lot of my patients tell me that losing weight gets harder with age. And I explain to them this concept that we describe as metabolic adaptation. And basically, it tells us why it's not just the aging process or getting older. It's every time we attempt to eat less and move more, diet and exercise, the body will let you get some result with weight loss. And people usually get to a certain point. They always say the last 5 or 10 pounds are the hardest because the body starts to fight back. When we're eating less and moving more, the body really thinks that we're in a famine state, that we're running around in the desert or in the jungle looking for food, because this is what our predecessors were doing. And in order to help us survive this famine, the body does a few things to make us regain weight. One of those is it slows our metabolism. And this has been proven with scientific studies. It also makes our hunger hormones higher and it makes our fullness hormones lower. So that's why those last 5 to 10 pounds are really the hardest, as people say, because the body wants you to go right back up to the weight you were, maybe even higher. Now, if you think about the average person making 8 serious attempts at weight loss over their lifetime, the body gets smarter and smarter. And that means the lows that people achieve get higher and the highs get higher. So when patients are coming to see me, they're really frustrated. And I explain to them this concept of metabolic adaptation, that our bodies really don't like losing weight and that we can utilize different strategies to fight this adaptation, because we live in an environment of plentiful. There's excess. We don't have a famine much anymore.
Can I ask you a question if you don't mind me jumping in? Because just commenting on what you just said, when I was 21, I lost 70 pounds. It basically just fell off of me. And I was able to keep it off for about 10 years. I guess my body adjusted. And that's when I hit on the back end. All of a sudden, I started to gain weight back. Mm-hmm. And it just couldn't come up. So that's what it was. My body was getting kind of smarter, hey, we've got to keep this off.
Yes, basically fighting that ability of you to eat less and move more. So what you did was that any particular plan you're on? Do you remember which one? Okay. So whatever you did. Yeah.
It was a commercial plan. And I had initially lost a lot of weight on there. But this time when I went back, it wasn't coming off as quickly. As a matter of fact, it wasn't really coming off much at all. And when I went to see them one week, I had gained weight, 1 pound. And they did not treat me very well. And I never went back. It was a tough time for me. But I was like, why is this not working this time? I'm following, a very similar plan. They had changed it a little bit over the years, but I couldn't get any weight off.
Right. And one thing about these group weight loss programs is people are in different phases of their weight loss journey, as the term we like to use. So some people, it's their first time. Some people, it's their second time, 8th time, 10th time. And we can't expect the same plan to work the same for everyone. And that's what I want to get across to the audience, that when we offer our employees, and I see as my patients, to do a commercial plan, to do a neighborhood plan or a group, and there's a lot of online diet programs. Some people get results and some people will not. So that's why, you know, people come and see me. I did that, it worked, now it no longer works, or that never worked for me. We call obesity a heterogeneous disease, where it's different even within the same person throughout their lifetime. So we need different options. So what are some of the step ups that you utilize once that type of plan no longer worked for you, Glenn?
You know what? I tried to really just exercise more because I thought maybe it's not the food. Because if I'm cutting back the food and nothing's changing, let me exercise more. I really didn't get anything out of it. I didn't see any weight. I mean, I might have been in better shape physically as far as cardio and all of that stuff, but the weight just laid there. Other things that I've done is, you know, I tried something where there's a commercial where they have pills and drinks that you'll drink like twice a day, not to get into games and all that stuff. And the weight started to come off of me on that. However, as soon as I cut that out and went back to regular food, it came right back. And I wasn't even eating as much food as I had in the past. It was just I started to eat regular food. So I found whatever I was doing, once I kind of stopped it, it just, you know, couldn't work with me anymore.
Yes, I hear this type of pattern a lot in my patients. And when I am talking to them, the frustration is quite obvious. Some people are tearful because they are getting a message. You can just do it if you keep trying. You know, just eat less and less and less. Continue to drink shakes all day and you'll be fine for the rest of your life. That even doesn't work sometimes. So I do offer them medications for weight management. And there are different types of medications for weight management, and different patients will have different options. The newer class of medications we've had starting around the 2012 mark really work very physiologically with the body to fight that metabolic adaptation that I mentioned earlier. And when we start certain medications, patients say, oh, I feel normal, which tells me that they did not feel normal. They were walking through the world feeling something's wrong with me. We checked their labs, nothing was wrong. But they don't feel, one, that their appetite was controlled, like maybe the next person in their office. They don't feel that they get results with doing the same diet like the next person they sit next to. And then also, they feel stigmatized. You know, they maybe feel discriminated against. Their family members may poke fun at them. And, you know, things like going in clothing stores is cumbersome and can be really frustrating as well. So giving the patients that knowledge of why our bodies don't lose weight as simple as a mathematical equation, you know, eat your calories fewer and you should go down, and how the medications can reverse all of those adaptations to weight regain, they feel that they have some hope. And you know, we do this under medical supervision. We're not giving a patient medication, say, good luck with this, try your best. We make sure we manage that throughout someone's life. So these are some of the different things that we offer patients in the clinic.
Can I comment on that, Dr. Lofton?
Of course.
Only because we're going back and forth between the patient and you as the physician. Yeah, I felt a lot of stigma in my life. And people might say, like, well, that was your fault. You weren't taking care of yourself. Mm-hmm. Yeah, that's not how it went. And I understand that a lot better now. But I've been in, we'll say, customer service for many, many, many years. And I've got to get past of how I look. Because people will look at me and say, this guy can't be smart because he's heavy. Because when you're living with obesity, that's the first thing you see when you walk in. And there were many times I would be next to a prettier person, a more pleasant looking person, however you want to say it, somebody that looked quote unquote more normal. And I was kind of going against, like, fighting my way up a hill because there was something that they had that I didn't have. So over the years, I had to make changes and get okay with who I am and develop a personality and all that stuff that goes with it. However, there was that constant battle of getting on an airplane and, like, please tell me this guy's not going to sit next to me, or going up to a food bar, a buffet, and saying, you know, people watching how much you're going to eat. And it gets on you. It gets on you. And that whole thing, this is where you really hit me emotionally. That whole thing of, you don't really feel normal. And really, for the first time in my life, I feel normal. So thank you for understanding that, because we don't hear that a lot out here. All we hear is what's wrong with you. And I don't mean to take from you talking I just wanted to add that.
No, that's really great of you to first be introspective and share that with us, because it's not well known how that affects you mentally, and that can lead you to avoid social situations. That can also impact the workplace, not coming in as often, having absences because of illness, or just not even feeling well. So that's how some of my patients have told me that, you know, I feel like I'm a better employee because I'm losing weight and I'm able to keep it off. So when we're talking about medications, was there ever a time where medications were discussed with you as an option for weight management?
Medications in the last few years. I was actually put on a medication that helped me with chronic weight management. And I was doing fantastic. Before I was on the medication, let me just add this. I had a stent. I had some cardio, some type 2 diabetes. Unfortunately, I've been through the through gamut because this has just been my journey over life. But once I was able to get on the chronic weight medication, the weight started coming off. I was able to look at things differently, eat quote unquote normally. The story I want to share with you the most is that I was at a job where I was able to get a particular medication. And I hope you're listening out there. I know we're talking to a lot of employees, and this is very important to me that you understand how it affects us in lots of different ways. I was able to get this medication. I went to another job. I could no longer get that medication. It wasn't on their formulary. So I had to stop. And after several weeks, my eating started to go back up again. I was kind of losing what I will call control. Not saying it's all about control. And I just wasn't in the best healthy place. I eventually went back to my original company. And now I was able to get on this chronic weight management medication again. And I was so happy. I was like, wow, this is great. This is going to give me that extra little help that I need. Unfortunately, about, 3 weeks or a month after I came back to the company, I was already on the medication. Turns out I needed another stent. So that year and, 14 months that I was no longer on that medication had a huge effect on my body. And some of you might say out there, well, that's your fault. It's not my fault. The medications are a tool. They do not do everything, but it's a tool that helps us. And I was out of work for a while, and there's just things that I had to watch. And now I'm doing much, much better. But there was that spot in between where I was no longer available. And that's where a lot of things hit me.
Oh, absolutely. Yeah, there's so many things that go on physiologically that are not very well known when you have obesity as a disease. So we're not looking for you or my patients to lose weight to fit into smaller dress and pant sizes. We're really looking to decrease the inflammatory state that's caused by the fat cell. My philosophy is that the fat cell is an endocrine organ, just like a thyroid or an adrenal gland, and it can become dysregulated. When a thyroid is overactive, we give medication to keep it back in check, because if not, people will have heart palpitations, they can't sleep, etc. Now, when a fat cell gets out of hand, it actually starts hormonally feeding itself. And this is, if the audience have heard of it, is what insulin resistance is. Insulin resistance is a condition that happens before prediabetes that can exist for decades and doesn't show up on labs. So again, labs all look normal. Doctor says nothing wrong. Just keep trying your best to lose weight. But it actually means the fat cell is feeding itself, getting bigger and bigger, and does not respond to diet and exercise. So when this is the case, we then need to treat this hormonal disease. And that's why we use some of the medications that we do. And I won't get into the complexities of the mechanism of these medications, but they actually do help fat cells shrink in addition to just appetite changes. So it's not about we're giving appetite suppressants, it's physiologic medicine to help decrease the inflammation related to fat, and that decreases the risk of things like heart disease and diabetes. And of course, we know these are big killers. Obesity is the #1 killer. Everything else is underneath that. If we had a sort of family tree of diseases that are killing Americans, obesity is at the top. And then we have cardiac disease, different types of cancers that really are plaguing our society. So as we think about how we can put those in a population scale level, having access to care for anti-obesity medications, really brings light to that. Bunny, did you have anything you want to share with regards to this topic?
I know there's, well, first of all, there's so much that you've already covered. But I was really just struck by, you say obesity is at the top of the top of the chain, right? In terms of being the #1 killer. If that's so, which we believe it is, like, why isn't there more, why isn't obesity taken more seriously in our society, as seriously as cancer or cardiac disease, right? So do you have a sense of that?
My thoughts are we need more education about the disease. And I think we're getting there. 10 years ago, definitely nothing was happening, even in medical school training. I left medical school, there was not one lecture about obesity or even nutrition, actually. So when I went into an obesity fellowship, I said, this is the first person to ever do this. There were really 2 training programs in the country, and this is just in 2008. Now there's about 20, but still not enough. And I think that because, one, physicians and medical providers were not taught to treat this as a disease, then we can't expect society to understand that it's a disease. So we need more education on many levels.
As somebody who's suffered with obesity, right? You were talking about throughout your life. How does losing weight change your outlook on life? How has that manifested itself?
That's a great question, Benny. It's at least for me, all of a sudden you have some kind of self-worth. I'm not that bad. People start to talk to you differently. People start to interact with you. They'll invite you to things more, or just take you a little bit more serious. As far as like employees, there are many times I had some ideas that wasn't taken as serious because I was looked down on. And sorry, that's just the way it was. But once I felt kind of normal and opened up my mouth more, I had lots of ideas, lots of things to share with my position that people are like, wow, that's a great idea. Why didn't you tell us that before? It wasn't that they didn't ask me to tell them before. I just couldn't because I didn't feel comfortable with myself. I'm at a different place in my life right now. So that's why I'm able to, do these things and talk, and people say you're brave. I'm not brave. What I'm trying to do is, and this is important for the employees to hear, employers, pardon me, we're trying to pull these people out of the shadows that have a lot they can add to your businesses, a lot that they can add to whatever your journey is on, and make things better for them. And that's what this is all about. If somebody feels more comfortable themselves and healthier and able to work without having as many times out, it's just better all around for everybody. So to answer your question, life just changed incredibly. It was really 2 different people. I was able to come out and enjoy life much, much better.
When people talk about meaningful weight loss, right? Like what does that mean actually? I mean, what is meaningful to a patient or, in general?
Yeah. So to me, anything, I would say 20 pounds or more is when it starts to become meaningful. Your clothes start to fit you differently. You start to see, different things. It's funny you say that because I hadn't lost weight for many, many years. And I lost the first week I lost 3 pounds. I was like, oh my God, this is incredible. I can't believe, this is happening. But what's 3 pounds? 3 pounds is a lot. It's a beginning journey. I start to see 15, 20 pounds as the weight gets higher and higher. It just really means a lot. And you've changed your life, really changed your life.
From a medical perspective, I can just say that when we look at the studies of what happens in populations, when we see the placebo group, so usually there's a drug trial and they say, all right, we're going to give half the people a fake drug and half the people the real drug and give them all diet exercise behaviors. So the diet exercise behaviors, eat less, move more. We tend to see about 2% weight loss in the group that does not have the medication. And to put that in perspective, that's a 200-pound person losing about 4 pounds. And then we see with some of the meds, 20% weight loss in the group that has the medication. And that's about 40 pounds in someone who is 200 pounds. So, you know, obviously which number is better, which patient feels better, but really the eat less, move more is not getting meaningful weight loss, not for health and not from the patient perspective.
Thing on that, is that's frustrating for you, right? As a provider, if somebody can't get the meds, right, if they need them. What else, you know, we often talk about patient experience. What about the provider experience in being an obesity medicine specialist? What are some of the challenges that you confront on a day-to-day basis that drive you nuts?
Yes, I can answer that very clearly. So I'll tell you, when I see a patient, I ask them, you know, why you're here. They filled out a long questionnaire with all different types of things they've done. Usually everyone's done pretty much every diet. They have a few health problems. And I ask them how much they want to lose. And usually they tell me something around 20%. And I break out some graphs and say, look, the likelihood of you losing 20% without meds is about 5%. And it's about 80% with meds. So they usually get excited and say, all right, I'll do the meds. I haven't tried that before. Is it safe? Yes. Is it effective? Yes. And so we get into this conversation. The patient has some hope. You know, their tears go away. They're smiling. And I type in their prescription. And I get a big red X. And my face drops and the patient looks at me, what's happening, and said, it looks like this is not covered by your insurance. And when I tell them the out-of-pocket price, it's thousands of dollars. And they say, I can't afford that. And then, you know, their face is drawn again. So we start to look into different options. And if they really don't have coverage, the patient, you know, loses hope. I give them diet and exercise recommendations, but if they really don't have coverage, they, you know, they can't afford. Some of these medications are like paying rent and car notes. So, you know, they really have a hard time fighting the battle. I mean, they're already in the weight management doctor's office. You know, they've done diet and exercise before. And then they question, well, why doesn't my insurance want me to lose weight? And say, well, that's a complicated social question. And it has to do with the fact that with a lot of these insurance riders, weight loss is sort of an off to the side option. Do you want to cover weight loss drugs? You have to check yes there in order for it to be covered under the insurance rider. If it's ignored, then the patients don't have access.
Glenn, so we have a question. Did your physician ever proactively talk to you about your weight?
Yes, all the time. And my physician, I'm not going to give you his name, is the greatest physician in the world. And he has saved my life on many different accounts. However, when it came to obesity, he said to me, Glenn, you've got to have willpower. And you don't have willpower. I keep a bag of potato chips in my closet at all times, and I know it's there. And I won't reach for it because I have willpower. This is him talking. And I just looked at him and I kind of went crazy on him. I'm like, are you kidding me? Is this what you're telling people? Is this what you're sharing? So he would talk to me about weight loss and getting my weight under control, but he really didn't have an answer for me other than the 4th or 5th decade of just eat less and move more and you'll be okay. And I said, Doc, that doesn't work for me. You don't have any problems with your weight? That's fantastic. Do you have any other problems? How are you with drugs? How are you with alcohol? How are we with any kind of narcotic? There are different things that we are latched onto. For me, it happens to be obesity, eating food. So if you're a physician, with all due respect to everyone out there, and you have not had the problem, a lot of times you can't understand what we're going through. You can't understand that thing of, I've got to eat this. But there is something out there that you have, something out there that you work with or do that you understand, I can't stop reaching for this. It might not be a bad thing. It might just be watching some kind of television show. That's my thing. And for those of us living with obesity, we can't stop. So I know I went off on a tangent, Bunny, but yes, I've had many, many physicians talk to me over weight about the years, but none of them had any answers for me.
How do you care for people when, you know, feel defeated and they feel defeated? Okay, yeah. How do you respond to people who feel, they've tried and tried and tried, and they feel defeated? Like what's one thing that you tell people, to do?
Life is not a dress rehearsal. This is it. Just keep moving forward. And if you can find somebody that, sorry.
It's okay.
If you can find somebody that can help you, go to that person. It's okay to fire your doctor because they're not doing the right thing by you. Go and find where the help that you can find it. Don't give up. We all have families, whether you have children or don't have children, you want to be there for your family. You don't want to give up. Just keep moving forward. You have to keep moving forward. Every little bit, every little inch is something.
That's great advice. We have a question from the audience. And thank you, Glenn, for being so open and honest. What can organizations do to balance the personal responsibility of an individual, right, versus recognizing obesity as a disease as an organization? That's great. Interesting question. I guess having more coverage options is one of the ways, but what else? Okay, so individual responsibility versus organizational responsibility. Would love to hear your thoughts.
I'll start.
I was just assuming you're talking to Dr. Lofton. Okay, thanks.
So I am a physician at NYU. I'm definitely not an executive there, or do I work in human resources, but I specifically went to the executives and asked them to please put weight management coverage on our insurance riders, because you want our employees to be healthy so they can come to work and treat people. And they did, and they actually did see the benefit of doing that, because there were fewer healthcare costs down the line with having to do fewer cardiac caths and things like that on their own employees. Also, the own employers are there. But more than just offering coverage, is offer a plethora of options. So a lot of employers will say, well, I have a wellness program that's free for all of our employees. They can go to this online wellness group where we have some classes, and that may work for some people, whether it's for mental health or for obesity, but it won't work for everyone. So having the spectrum of lifestyle recommendations, wellness recommendations, things like acupuncture, meditation, and even if you're not paying for these, offering these and making people aware that they are available for them can really help the employer understand that the organization is aware that this is a condition, but to offer coverage options. So for example, many plans offer bariatric surgery, but don't offer medicine. So then you have this group of people who are too light for surgery, but too heavy for diet and exercise to work, that need to either gain weight to have surgery, and we're not really treating those patients. So just access to many options, I think, will be helpful.
Did you want to offer?
Sure, absolutely. If I'm an employee, you've hired me because I can do something for you that is great for your organization and it'll help you. If I had high cholesterol and it was genetic based versus some kind of food problem, would you say to me, we're not going to help you because of cholesterol? No, you would say, absolutely. What can we do to help you? I think that people don't see, they still don't, because I have many conversations. People do not still see obesity as a disease. They think it's just something that you're doing wrong. Even if you have a conversation with people, they buy into it. But the longer the conversation goes, a high majority will say, this isn't a disease, it's about you. So we've if I'm an employee and your employer, we're in a contract together. I will do everything I can for you, and you're actually offering me some great things to take advantage of. With that being said, I can even, if we're going to make it about this, I can even work harder for you and get more things done the healthier I am, without taking time out of work or being able to think clearly without worrying about things. So yeah, there's a difference between, if you're saying like, well, that's an expensive medication. There's a difference between expensive and cheap. We all know that it is. And if you're on I've been on several medications for many different things, and now I'm not on many because my obesity is getting better and I'm being under control. So the 5-6 medicines that I'm no longer on, they might be $1,500 a month once we really look into the cost of them. So let's make sure we're not chasing nickels with dimes. You know, cost is like, you need to look at cost and see the reality of it. You would for everything else in your business. So we need to look at also as far as for the patient. And I don't mean to preach. This is very important to all of us here. And I know that.
It's such a great point, by the way, that you just made, that you're on a whole bunch of other meds, right? That all add up, and, you know, yes. And you can many times get rid of those. I feel like obesity, and I'd love to hear your, both of you, your reaction, but, you know, mental health, you know, 10 to 15 years ago, like, we'll just feel better. Just, you know, just get out of bed. Like, what's this with depression, right? And now people are really taking it so much more seriously as a disease, not just a personal issue. Do you feel like that's finally happening with obesity? I'm sad to hear you, you know, I get that people are not all aware like we are that it's a chronic disease, but do you feel things are changing?
Are you asking me or Dr. Lofton?
Both of you.
Both of you. Dr. Lofton, you want to take that first? Because you've got a much broader view than I do.
I'll answer from the medical community. I mean, I definitely see more patients being referred from their physicians now than in the past, let's say 5-6 years ago. Because what I hear a lot was, I told my doctor I want to lose weight and they threw a paper at me, or they told me to go to a program online or go to a group, sort of a group type of setting, and then talk about your weight. And, you know, same thing, people talk about your feelings. Whereas now they say, oh, we'll go see the medical weight management team. And, you know, maybe we could talk about a medication. And that is really changing in the medical field. Now when we leave the hospital and go outside, I don't know if the world is changing as fast, but I think there is some progress being made.
That's great. You know, I have lots of conversations with people, friends, family. I've lost weight. I like to talk about obesity because, again, I want to bring people out of the shadows and show people how important it is. So people are really starting to understand that it is changing, and they look at things differently. They'll look at you differently, like, wow, there really is some kind of disease. But at the end of the day, like Dr. Lofton said, and you said also, Bunny, if I can't get this and there's no access, then that's a tool I don't have in my basket that Dr. Lofton doesn't have to, you know, approach us with. And so here we are. We're just standing still. And I've told you we should be moving forward. We are moving forward for certainly, but at a slow, kind of a slow pace. One of the few things, very few things that was good about COVID is it got people to look at obesity. Wow. There's a lot of people that are, you know, we lost for different reasons, and obesity was one of them. So we need to take a much more serious look at this. So this is what I see a little bit more, but it's spotty. And people who are in positions to really sing that song or tout that line of, hey, these are people living with diseases, man, you owe this to the, you know, you have this ability to change things. And if you can change anything, no matter what it is, and it's in a positive way, that's what I believe we're here for. I really do.
Amen. All right, now we have 2 more questions. This is from Dr. Aloe, who's a cardiologist, who I think is a wonderful woman. So hello, I'm glad you're here. Dr. Lofton, can you discuss medical conditions that can cause obesity?
Definitely. So I'll tell you that first, obesity is its own condition. There are both environmental and physiologic reasons why obesity can occur in someone who did not previously have obesity. So we're all prone. So one example is medications. I see patients who have breast cancer and then are prescribed medications to prevent breast cancer, and they recurrent, and they have to take it for 5 to 10 years, but then the side effect is weight gain. And then they have to balance. Should I prevent breast cancer or should I lose weight? And there's no way around that, because when you have medications causing weight gain, that does not respond to diet and exercise. So we usually use medications to reverse that. So that's an environmental, physiologic reason. There are people who have medical conditions such as they can no longer move as they used to. They have arthritis, muscular dystrophy, multiple sclerosis. That can be a change. It's a physiologic issue that causes a change in their environment. Maybe they're in a wheelchair now, or they have a boot on their foot, and that caused their body to shift toward a higher weight. Of course, we are aware that thyroid disorders, when they're untreated, can cause obesity and a few other endocrinologic reasons. But I'll tell you, one of the most common is medications. Steroids people get prescribed. Some of the antidepressants that people take for decades cause them to gain weight. So it's more likely to be something that's, we call it iatrogenic. The doctor gave it to you that made you have obesity, rather than another condition causing that obesity. It's more common to see it from meds or some type of physiologic change, because our weight is determined 40 to 70% by our genes. So there are people who will never need to watch what they eat and will never gain weight. And we have the reverse, people who eat very little and move and will gain weight.
You've said time and again, what in and out are not the same, right? Like for, you know, the old myth of 3,000 calories a day or whatever. It just doesn't work for everyone. All right, well, we are pretty much at the end of our time. This was so enlightening. Thank you for our first chat. I love the dialogue between you two. You don't often get to see that between a doctor and a patient. You're both very passionate about the area. We are going to be hosting more of these coffee chats. We're going to send out after this, you know, a note. We'd love to hear from the group, what other topics you'd like to hear about. But I guess I'll leave you with this. At least I hope from today's call or from today's chat, you get a sense of the reality of living with obesity and treating obesity, and that it is a chronic disease. And so, you know, just as we look at other chronic diseases, we need to look at obesity very seriously, as well as all the treatment options. So thank you so much, Dr. Lofton. Thank you, Glenn. I hope you both have a fabulous weekend. And thank you, everyone who joined us today. Have a wonderful weekend.